ಆರ್ ವಿ ನಟರಾಜನ ಹೆಸರು. ನಮ್ಮ ಊರು ರಾಯನಹಳ್ಳಿ, ನಮ್ಮದು ತಾಲೂಕು ಡಿಸ್ಟಿಕ್ಕು ಚಿತ್ರದುರ್ಗ. ನಾವು ಬೈಕ್ನಲ್ಲಿ ಬರುವಾಗ ಹಿಂದೆ ಬಿದ್ದಿದ್ವಿ. ಹಿಂದೆ ಬಿದ್ದಾಗ ನಮ್ಮ ಸೊಂಟ ಇದಾಗಿತ್ತು. ಚಿತ್ರದುರ್ಗಕ್ಕೆ ತೋರಿಸಿದ್ದೀವಿ. ಅಲ್ಲಿ ಆಗಲ್ಲ, ಕಾಲು ಬರೋಲ್ಲ ಅಂತ ಹೇಳಿದರು. ಹಾಗಾಗಿ ನಾವು ಬೆಂಗಳೂರಿಗೆ ಬಂದ್ವಿ. ಇನ್ಫ್ಯಾಂಟ್ರಿ ರೋಡ್ ಸ್ಪರ್ಶ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದ್ವಿ. ಅಲ್ಲಿ ನವೀನ್ ತಹಶೀಲ್ದಾರ್ ಅವರು ಚೆಕ್ ಮಾಡಿದರು.
Hi, we had this patient, Mr. Nataraj, who came to us with a spinal cord injury. He sustained this injury while he was driving a bike. So he came somewhere on the 24th of May, and he came around the midnight. We did some investigations like MRI and CT scan.
MRI ಸ್ಕ್ಯಾನಿಂಗು ಇವೆಲ್ಲ ಮಾಡಿದರು. ನಿಮಗೆ ಬರುತ್ತೆ, ನಾವು ಮಾಡ್ತೀವಿ, ನೀವು ಇದು ಮಾಡಿರಿ ಅಂತ ಹೇಳಿದರು. ಹಾಗಾಗಿ ನಾವು ಅಂತ ಒಪ್ಪಿಕೊಂಡಿವಿ. ಆಪ್ರೇಷನ್ ಆಯಿತು. ಒಂದು 5 ದಿನ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಇಟ್ಕೊಂಡಿದ್ರು. ನಮಗೆ ಚೆನ್ನಾಗಾಯ್ತು. ಅಲ್ಲಿಂದ 20 ದಿನಕ್ಕೆ ಓಡಾಡೋಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ವಿ. ನಮಗೆ ಆರೋಗ್ಯ ಚೆನ್ನಾಗಿತ್ತು.
So basically he had a fracture in the spine, and which had caused a spinal cord injury. So these kind of patients have different kinds of spinal cord injury. So it starts from grade A to grade E. Grade A being a very severe spinal cord injury, and grade E being a very mild kind of a spinal cord injury. So Nataraj was somebody who had an incomplete spinal cord injury. So in this patient Nataraj, we could stabilize the spine early and we decompress the spine. Decompression means we remove all the pressure that is there on the spinal cord. And I am glad that Nataraj made a remarkable recovery. By about 3 to 4 weeks, he was able to walk and he regained a full movement. And now at the moment he's about let's say about 8 months or 9 months down the line, and he's able to do most of his household work, and there is very little disability in his life. And I think the message that should go across in the patients like Nataraj is that the moment they have an injury, any person that you encounter on the road who has a possible spinal cord injury, which means they are not able to move their legs and they have pain in their back, it's important to transport these patients as early as possible to the hospital. 1, 2, you should not have any undue movement on the spine. So you should make sure that you keep them on a hard board. If you don't find anything, you can just take 2 wooden blocks, place the patient on a wooden block and carry them to the hospital, preferably in an ambulance or in a car, but make sure that there is no undue movement in the spine, whether it is the neck or whether it is the upper back or the lower back. Make sure that there is no undue movement and get them to the hospital as early as possible, because these spinal cord injuries, if treated early, can lead to some good results.
ನಮ್ಮ ಡಾಕ್ಟ್ರು ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂಡ್ರು. ನಮ್ಮ ಹಾಸ್ಪಿಟ್ಲಿರೋರು ವ್ಯವಸ್ಥೆ ಚೆನ್ನಾಗಿತ್ತು. ನಮಗೆ ಫುಲ್ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರು. ಧನ್ಯವಾದ.